Harness racing and standardbred horses come to life each month in the colorful pages of Hoof Beats, the sport's most widely read magazine. We call it Reporting with Horsepower. Don't miss a single issue. Subscribe online today.
OCD is an abbreviation for Osteochondrosis dissecans, which technically means a cartilage flap. And it is essentially a developmental problem where cartilage has difficulty converting to bone on the joint surface, and therefore it leaves an irregularity or a flap or some abnormality within the joint in a young growing animal. It occurs and develops during growth and development. So that means weanlings, yearlings, 2-year-olds. You certainly can have older horses with the fragment or flap in their joint, but it formed back when they were young. The different joints tend to crop up at different times in age. So the stifle joint, which is the knee joint, and the shoulder tend to crop up at about 8 months with the horses going lame. They tend to go lame with those. And the joint swelling, the shoulder, you can't see that much, so it can be a tougher diagnosis. But the stifle is usually diagnosed around 8 months of age. Whereas the hock, or the tarsocrural joint, tends to be diagnosed in late yearlings when they're starting to be put into work, whether that be in a standardbred, actually being trained and harnessed, whether that be in a quarter horse starting to maybe get under saddle. That is when those joints will tend to develop the effusion, so at about 1.5 years. The most common problem would be joint effusion, which is joint swelling, and that's excessive fluid in the joint. And depending on the location of the OCD, lameness. The hock, which is the most common joint affected by OCD, which is specifically the tarsocrural joint, seen right here, that joint does not tend to show much lameness associated with the fragments, but does show the swelling termed bog spavin. The point of the shoulder, there's an actual indentation right here, which is the closest point to the shoulder joint that is deep to that. And they would get OCD on the humerus or the scapula part. Can be on either or both. The fetlock joint is down here, and you would see swelling right where my finger is now, which is below the splint bone and in front of the suspensory ligament. There is a pouch of the fetlock joint at that location that when they get effusion, you will see a puffiness right there. On the hind limb, it's right below this muscle mass right here, and you will see swelling pooching out right at this location. This is the femoropatellar joint, which is the most common site affected with OCD within the stifle. The hock joint would be seen as puffiness here in the back on what are called the plantar pouches, or in front here, which is the dorsomedial pouch of the joint, and you would see a bulging of fluid at that site in a young horse. So a sire may have 1,000 offspring and only 50 may have OCD. And then of that, there's other conditions such as excessive energy intake. Exercise is not a direct factor, but can make the clinical signs worse, or could cause a fragment to break off or raise up and create more clinical signs. And really there's no way to prevent it. And once you have it, you have to decide whether your horse can do okay with just conservative management or whether surgery is the recommendation. Treat the inflammation and heat while it's there, which usually is very short term when they get the joint inflammation because the fragment has moved somehow or the cartilage has blistered up. They will frequently have heat and inflammation. If you stall rest them, put them on some pain medicine, possibly some anti-inflammatory medicine, that can go down. And then essentially you live with the joint effusion. So for the standardbred, hock and fetlock are the most common joints affected with OCD.